Good afternoon, everyone, and welcome to the public inquiry of the Joint Select Committee on Social Services and Public Administration. On behalf of the committee and staff of the Parliament, I would like to welcome you to our fourth Town Hall meeting of the JSC on Social Services and Public Administration and the Public Healthcare Services in Trinidad and Tobago. We are pleased to be coming to you live from the borough of Arima. I think you should give yourselves a round of applause. You're well represented here today. Thank you for joining us once again. Members of the viewing and listening public are invited to submit their comments and questions on the topic under discussions via the Parliament social media platforms or by email parl101@ttparliament.org or Facebook, TT Parliament, and X, formerly known as Twitter, @TTParliament. At this time, I'd like to introduce you to the members of the committee, starting on my immediate right with the Vice Chairman.
Good evening, all. Roger Monroe, Vice Chairman of this committee.
May I go now to the Member of Parliament for Arima?
Penelope Beckles, Member of Parliament, Arima.
I saw you brought the fan base. Member Singh.
Good afternoon, Mr. Chairman. Good afternoon, colleagues, and good afternoon, Arima. Avinash Singh, I'm a member of this committee.
Member Mohit.
Good afternoon, Chairman, members of the committee, and you, our members of the public. Member Mohit, member of this committee.
Forward.
Mr. Chairman, you see we getting no applause on this side, but we'll accept it.
Are you asking?
Esmond Ford, member of this committee. Pleasant good afternoon, good evening to each and everyone. Thank you.
And of course, our guest who will be helping us this evening or this afternoon is Dr. Jamila Augustine, Acting County Medical Officer, Health, Mariva and Meru.
Good afternoon, Chairman. Good afternoon, members of the board, and good afternoon to the public.
We'll be joined in, thank you. We'll be joined in process by our member David Naked, and there's one other member of the committee who is unable to be with us. That's member Sinanan. So welcome once again. The purpose of this town hall meeting, it's being held to provide the public, citizens, you, the taxpayers, with a platform to directly engage members of Parliament, your representatives, on some of the critical issues concerning the delivery of public healthcare services in the country. This is an opportunity for you to share your experiences, having interacted with the public healthcare system at one stage or another, or with a family member, to make recommendations for improving the public healthcare system. And of course, the term public healthcare system is a very broad and multifaceted area. So the committee, for the purposes of this inquiry, has narrowed the focus down to three main areas, which we'll be sticking to this evening and this afternoon. One, combating non-communicable diseases, including diabetes, cardiological diseases, and cancer. Two, the effectiveness of the Chronic Disease Assistance Program, CDAP. And three, the standard of service at outpatient clinics. So far, the committee has had three town hall meetings. The first at the Parliamentary Complex on Wednesday, November 29th, 2023, that's last year. The second in San Fernando on Thursday, January 18th, 2024. And the third one in my colleague's constituency, Member Mohit, in Chagwanas on Thursday, March 7th, 2024. So we're really happy to be in Arima, your guests today, to interface with you. So let me just also identify what the committee is not empowered to do. We identified earlier on what we're here to do. What we're not empowered to do is to actually provide redress or answer questions. We want to hear from you, and that's why we're here. Or remedies for particular situations you may be experiencing. We want to hear about the situations, but we can't give you answers right now. We're collecting information and data. We do have the power to hold the entities responsible, however, for public healthcare policy and management, responsible for their performance, their policies, their procedures, their programs and initiatives under the Ministry of Health and also the regional health authorities. We are one of 14 committees of Parliament appointed to scrutinize and or oversee certain aspects of the work of the government of Trinidad and Tobago. The committee's work is not directed by any political party or does not have any political agenda. The mandate of this committee includes investigating and reporting all matters related to the management, activities, administration, and operations of various state bodies with a focus on education. This is the overall committee: health, gender, tourism, public administration, labor, culture, community development, and other social services. At the end of this inquiry, the committee will submit a report to the Parliament of Trinidad and Tobago containing its findings and recommendations, which will be sent to the Ministry of Health and the regional health authorities for their attention and for their responses. We would like to acknowledge some very important stakeholders before we start, including the Trinidad and Tobago Association of Retired Persons, the Geriatric Society of Trinidad and Tobago, the Diabetes Association of Trinidad and Tobago, the Trinidad and Tobago Registered Nurses Association, the Trinidad Tobago Medical Association, and the Trinidad and Tobago Cancer Society. So let's give them a round of applause, please, because they've been very helpful in this exercise. And of course, we'd like to hear from you. That's why we're here, to hear about your experiences in the healthcare sector, specifically related to non-communicable diseases, including cancer, diabetes, and cardiological diseases. At this time, I'd like to invite our guest, Dr. Jamila Augustine, to give us an overview and give us a sense of what NCDs are for your general information and elucidate us on what we can expect in terms of the topics we're covering today. Dr. Augustine.
Thank you, Chairman, for that introduction. Good afternoon once again to the Chairman and members of the Joint Select Committee, members of public present here, and members of the viewing and listening audience. I am Jamila Augustine, the Acting County Medical Officer of Health for Nuevo Mayaro, and I work with the Ministry of Health, and I'm here to share a brief overview on NCDs, or non-communicable diseases. This refers to chronic diseases and a group of medical conditions that are not caused by infectious agents, so they're not transmitted from one person to the next. These diseases typically develop over a lengthy period of time, so we're referring to a number of years, and they're associated with a combination of genetic, environmental, and behavioral factors. So common examples of NCDs include high blood pressure or hypertension, diabetes, chronic respiratory or lung diseases, and mental health disorders, as well as cancers. Several NCD risk factors are not amenable to change, and they are referred to the non-modifiable risk factors. And these include age, sex, genetics, and ethnicity. However, NCDs share several common risk factors that can be changed, and these modifiable risk factors include lifestyle choices, unhealthy diets, which can contribute to being overweight or obese, physical inactivity, the harmful use of alcohol, the use of tobacco, and of course, the newer nicotine agents such as vaping products. And additionally, these socioeconomic factors, such as poverty, inadequate access to healthcare services, and limited health education also can exacerbate the NCD burden, particularly among our vulnerable populations. With respect to the 5 critical NCD risk factors, smoking, overweight or obesity, high blood pressure, poor diet, I'm referring to consumption of less than 5 servings of fruits and vegetables daily, as well as low levels of physical activities. Of these 5 risk factors, only 1% of the population has none of these. Just over half of the population aged 25 to 64 years old had 3 or more of these risk factors and are therefore at an increased risk of developing NCDs. This also supports the fact that younger persons in Trinidad and Tobago are being diagnosed with chronic diseases and also develop complications at an earlier age. Complications including strokes, loss of digits or limbs, heart attacks, etc., which can notoriously impact not just the individual's life, but that of their relatives. NCDs represent a significant health challenge in Trinidad and Tobago with profound implications for public health, healthcare systems, and socioeconomic development. The World Health Organization estimates that NCDs account for over 70% of deaths worldwide. Notably, Trinidad and Tobago has one of the highest NCD rates worldwide, and NCDs are the leading cause of morbidity and mortality. So that refers to death and loss of quality of life here, accounting for approximately 60% of all deaths each year. According to the National Strategic Plan for the Prevention and Control of NCDs in Trinidad and Tobago, heart disease represents 1/4 or approximately 25% of these deaths annually, followed by diabetes at 14%, cancer at 13%, and cerebrovascular disease, which are medical conditions that affect the blood vessels of the brain, the most common type being strokes. These account for 10% of these deaths. Heart disease is also the leading cause of premature deaths in both men and women. NCDs also contribute substantially to premature disability, placing a heavy burden on individuals, families, and the healthcare system. Based on a nationwide survey conducted by the Ministry of Health, the most prevalent NCD in Trinidad and Tobago is hypertension, with 26.3% of persons surveyed were noted to have elevated blood pressures or were currently on antihypertensive or blood pressure lowering medications. Hypertension is also referred to as a silent killer because you can feel quite well even if your blood pressure is at dangerously high levels. And this is where the role of screening comes in, which I will speak about shortly. The high prevalence of hypertension in our population increases the risk of death also from heart disease and diabetes, which are the top two causes of death in this country, as I mentioned before. Addressing the NCD epidemic requires a comprehensive and multi-sectoral approach. This approach is quite complex and involves implementing policies and interventions aimed at promoting healthy behaviors, improving access to healthcare services, and creating supportive environments for healthy living. Broadly speaking, essential components of NCD management involve prevention and control strategies to reduce the occurrence of NCDs, and where it is already present, to decrease the likelihood of complications and improve patient outcome. These measures include effort to reduce tobacco and alcohol use through legislation, smoking cessation programs at primary care level, and the development of a national policy on alcohol. To mitigate physical inactivity and unhealthy dietary practices, numerous campaigns and initiatives have been launched, including TT Moves, Know Your Numbers, and Healthy Me camps were developed and implemented in various settings. In the Eastern Regional Health Authority, for example, exercise sessions are held weekly, and these are led by physical trainers from Trinidad and Tobago Defense Force, while the North Central Regional Health Authority officially launched its Wellness Club in 2023 and conducts regular hikes, yoga, and other fitness activities. Age-appropriate screening is also offered at all health facilities in their walk-in services, and we encourage persons in the communities to have an annual medical checkup done at these clinics and also at their community health fairs. The clinical care capacity has also been strengthened to assist with NCD management with the expansion of the CDAP program, as well as the development of evidence-based national guidelines and protocols to treat with clients in primary and secondary care. And the most notable initiative here is our Hearts Initiative. And this was an initiative of the WHO in collaboration with the Pan American Health Organization, along with the Ministry of Health, focused on initial management and control of cardiovascular disease and hypertension. And thus far from the implementation in 2019 to present, we have seen a significant improvement in the management of our clients with hypertension due to the introduction of this initiative. Additionally, the ERHA has a very active men's clinic from the Guayari Outreach Center, and they utilize a WhatsApp group to share information, foster community engagement, and boost men's wellness. And this is just one of the men's initiatives that has been implemented within the past year. There's also been several women initiatives that have been held, aimed to educate women and raise awareness on cervical and breast cancer, and involves screening in different facilities. Furthermore, enhancing surveillance and monitoring of NCDs, as well as promoting research and innovation, are crucial for effectively addressing the NCD burden in Trinidad and Tobago. A national research agenda for NCDs has been developed and implementation is being scaled up. Collaborative efforts involving government agencies, healthcare providers, civil society organizations, the private sector, and international partners are necessary to implement evidence-based interventions and policies that can mitigate the impact of NCDs and improve the overall health and well-being of our population. In this regard, diabetes and cardiology outreach programs were also initiated through collaboration with different ministries, as well as local and academic institutions globally. There's also ongoing MHGAP training to better equip the staff at the local health centers to manage persons with mental illnesses when they are accessing care at our local health centers. In conclusion, NCDs pose a significant public health challenge in Trinidad and Tobago, with far-reaching consequences for individuals and our society as a whole. Addressing this challenge requires concerted efforts to prevent, diagnose, and manage NCDs through comprehensive strategies that encompass both health promotion and disease management approaches. By prioritizing NCD prevention and control, Trinidad and Tobago can work towards achieving better health outcomes and enhancing the quality of life for its citizens. Thank you.
Let's show appreciation for Dr. Jamila Augustine, Acting County Medical Officer Health, who is, of course, a subject matter expert on our topic to the NCDs and the public healthcare system. Just like to advise you, I know when we have a medical professional in our midst, we want free advice. Dr. Augustine is not here to offer free advice, okay? Just to give you an idea of how we'll proceed once again, for those of you who just have come in, and thank you all for being here today, by the way. If you would like to make a contribution, ask a question, you simply need to make your way to the open mic, which is at the center of the room. You can identify yourself, and if you care to identify an organization that you may be representing, you can do so. You can make your contributions, of course. They need to be respectful, avoid using any insulting or obscene language, and you can be as concise as possible so we can field as many comments and or questions as we can in our interface this afternoon to evening. And of course, we thank you for being with us here today. And we're happy to be in ARIMA. So now, as we said earlier on, the main areas that we'll be covering today will be the following: governance and management of the public healthcare system. Then we'll move to access to screening. Then we'll move to access to treatment, access to medication. Then we move to patient record management. And then we move to prevention and public awareness initiatives that you may have heard about or that you may have recommendations for. So at this time, we'd like to start hearing from you. And we will start with Member Avinash Singh. Member Singh.
Thank you very much, Mr. Chairman. And a blessed good evening to all of my colleagues on this table. Thank you, Doctor, for the opening for us this afternoon to set the tone in terms of what is our purpose. And a blessed evening to all of you from ARIMA. I'm very, very happy to see almost every chair filled to capacity. And this just shows us at the committee, you know, the importance and the critical nature of what we are here to do. Before I go into my line of question, most times, most of you would know that our parliament structure, you all mainly get to see us doing all the talking. Today, it's a little bit different because this is where the parliament is directly reaching out to you, and we want to hear from you in terms of your experience interacting with the state agencies as it relates to health. And thereby, whatever you experience, you share with us today, it will shape our report going forward that will be laid in the parliament that will then recommend, you know, solutions to some of the problems to the policymakers and by extension, the government. As it relates to governance and management of the public health care system, firstly, I would like to ask you all, are you satisfied with the current governance and management of the public health care system in Trinidad and Tobago? And as it relates to we want to hear from you some of what you think might be the weaknesses of the regional healthcare facilities. In terms of the opening times and closing times of the facilities, we would like to hear your experience in relation to that. Share your experience in that. And then when the floor is open, we would like to hear, describe your most recent experience visiting a public healthcare facility. And we would like you to give us your personal experience. What were the good aspects, if there were, and what were the negatives? So without further ado, Chairman, I would like to ask and pose this question to the public in relation to governance and management of the public healthcare, for members of the public to share their experience as it relates to these items I've outlined in terms of the opening and closing time, in terms of the positives and the negatives. Thank you, Mr. Chairman.
Thank you. The floor is open. You can make your way to the microphone. Just indicate by a show of hand if you're ready to make a contribution, a question or comment. Yes, I'm seeing a hand in the back there, so we can start with the lady in the back. Yes. Anyone? It only takes one to start. There you go. Thank you, ma'am.
Good evening, everybody. My name is Hilary Bernard. I am here as the president of the Arima Community Council. I just have two short questions. I don't know if it falls squarely into the categories you asked about, but one of them is the availability of reagents for blood tests at our public institutions. I have quite a few friends who visit the hospitals, and far too many of them talk about the unavailability of reagents that have to be used in many of the tests. And so they are referred to private institutions who seem to be able to access the reagents when the public institutions can't. That's one. And the other one is
are they referring you? Sorry, are they referring you to specific private health institutions or generally?
No, just generally.
Okay, thank you.
Because the tests are needed in a timely fashion, so they have to seek help elsewhere. The other one is really, I am a dentist by profession, and I know that we're talking about policies. The Ministry of Health has a dental policy which says that children under 12 years and adults over 18 can access care at the dental facilities. It completely leaves out those who are between the ages of 13 and 17. And I wondered what could be done to change this policy, especially since our Vision 2030 talks about not leaving any part of our community out. So those are my two questions, and I'll take my seat. So
thank you so much. Anyone else? And remember, right now we're dealing with governance and management in terms of if you are satisfied with the governance and management, if you have an issue with the opening and closing times, what was your experience like, your most recent experience like in interfacing with the public healthcare system? Anyone else would like to deal with this matter? Question or comment? When the floor was open earlier on, quite a few of you said no. I heard it. So no is not going to help us create our report. We like a little more information than that. So if you said no, all we want to know is what your experience was like and how you think we can improve the experience in terms of our recommendations. Anyone would like to come forward to share? Yes, thank you, sir.
Good evening, everyone. Members of the head table. My name is Nasser Hussain. I'm a resident of number 16 Gomez Street, San Randy. I have a little problem with respect to, I did a CT scan at the San Randy Hospital in January, early January. And to this day, no assessment or whatever term you use. When I checked with them, there's no results at all. So I think, well, there are many others who are complaining of that also, right? And I think you don't know what a scan could reveal. and it's now 4 months. Right?
Were you given a time within which to come back to get the results of the scan?
They say within 1 month.
Within 1 month? And
it's
it's
today,
been 4 months and
yeah.
they just called you.
yeah.
Have you called them to ask them what's the status of your scan?
I live a stone throw from the St. Randy Hospital.
Mhm.
You can see the new St. Randy Hospital from where I live. So instead of driving, I walk to that hospital. And very regularly, after the month, every week I checked. So I would suggest that these sort of things should be fast and furious with respect to analyzing a report such as this. All right.
Did you see a doctor in your interface or a nurse or somebody specific?
To this day, no reports went to the doctor I'm dealing with. Right? Not even the bloods.
And you did the scan at the hospital?
At the hospital.
Okay. Anything
All
else
right.
you'd like to share? Thank you for sharing that.
Well, I mean, I don't know. I don't know if the question was raised. I would like to know when are you all gonna open the Cuba Children's Hospital?
We're not here to deal with the Cuba Children's Hospital. So
Thank you.
thank you, sir.
Thank you, but
No, before you leave.
my matter, please, because we don't know what's going on inside here.
Thank you so much. Thank you for sharing. Anyone else? Thank you, sir. Oh, let me go with the lady first and then yourself.
And I'm a cancer survivor, breast cancer survivor.
Can you come forward a little bit, please?
Okay.
We're happy that you survived.
And like this gentleman here, I want to bring forward the same concern, because with cancer, it progresses, some aggressively, some in a slower pace of time. But it is important once you are diagnosed that all the other things come into play in order for the doctors to be able to give you a proper treatment process. One of the tests you have to do is also a CT scan. And I can tell you, for a number of I'm not saying for all, but for a number of patients, the timing in which you get the response from a CT scan could change you from a 1 to a 4. And that is your health. And it's also an additional cost to the government, because the higher the stage, the more expensive it is. So the faster you could get the responses from CT scans, the better it is for the whole process, for the healthcare to work.
What was your time frame like in terms of receiving the scan?
No, I'm not speaking for me
Or
in
from people
particular.
who've told you? Okay.
I'm speaking about a general situation that obtains.
Yeah.
Right? I can't give you percentage, but it is a reality for many people. Right? So I just want to endorse what he was saying. And it's not necessarily Grandy Hospital. We're talking about the St. James, Eric Williams Medical Sciences, Tutlamo.
Thank you. We wish you continued good health.
Thank you.
Thank you. Sir? 1 second. We have a question from member Moore. Go ahead.
Just for some clarification, we heard 2 persons in terms of the lengthy periods following your CT scans. We also heard that you would have checked with the RHAs wherever you would have done your CT scans, or maybe who you are speaking on behalf of. However, when you are checking, what's the information being given to you for the delay? Any type of information that you wish to share with us, the reasoning for the delays?
I don't know if you want to share what was being told to you.
Yeah, okay. I was told that at the desk, the building here, right there, where they do the CT scan, right? The person said that no, assessment was done on the scan, or no result from it then. All it was done in January, and being told that the results will be in a month time. So,
Every time you went after the first month, they told you that?
Nothing, nada, zilch.
Okay, thank you.
Right, thank you.
Ma'am?
Following the same thing, is that it seems to be that there's a shortage of persons to do the reading of the scans and get the report out.
Thank you. Sir, somebody want, yes, thank you.
Pleasant evening to the chairman and the committee and all members attending. This is specific to Dr. Jamila Augustine. I know you would have stated that the situation is at an epidemic stage and it caters for approximately 60% of deaths. All right. I can understand the factual aspect of that, but there's a situation with, let's say, patient A. Patient A had an appointment on the 8th of April, 2024. All right, that was a Monday. She was then contacted prior to the appointment, she was contacted on the 4th of April, which was a Thursday, and stated that the appointment would be rescheduled, which for whatever reason, we can understand situations do occur. All right, she was waiting for the reschedule period of time. She was contacted then on the 22nd of April, Monday gone, and stated that her cardiological appointment have been rescheduled to September the 15th. Now, that in itself scared me, but what made it even worse is that it's September the 15th, 2025. All right? So that raised a red flag for me. Me being a child of a cancer victim who died of dehydration because she got overdose of radiation. So things like that I'll pay particular attention to. So one of the points you all brought up is the turnover time. And I'm seeing it even with the CT scan that just brought up. The turnover time between appointments or being diagnosed and the appointment and the induction of whatever process that has to happen, that is, from that one situation, is very ridiculous, right? Secondly, I know that with eyes, they have the glaucoma and then they have the cataract. The glaucoma is a lot worse, but we're having a similar issue where persons are being informed that at present, someone was informed in January, let's say patient B, that he will be contacted in August, between July and August, in order to set an appointment for surgery for 2025. All right. So I just wanted to bring up those two experiences I would have had with persons that I was engaging with.
Thank you so much. What could you specify which RHA, what region that person went to the hospital?
All right. NWRHA, both patient A and B.
Okay, thank you so much. Sir?
Hi, good afternoon.
Afternoon.
Kisun, Arima Business Association. So I see that we highlighting the Regional Health Authority model. I am concerned that some of these RHAs have too much on the table to handle in terms of the amount of clinics that they may have under their purview and the amount of people they need to service. I think as though the volume of people that head into the health hospitals need to either be managed better with another additional RHA, because it's been a while that we've been under Northwest Regional and Arima, and we've added constituencies, we've increased population, and we still don't have enough. I mean, sometimes just a few clinics will help reduce the overload in the hospital, because a lot of the time some people just need to get a prescription for an antibiotic, somebody get a cut and just need a few stitches. And you know, we don't want to be going to the hospital all the time for those things. Those are things that we can handle at the clinic. And then we have to also consider the parents who work in and what happens after in the evening to be able to get attention. I know that lockets are used to open in the evening. I don't know if that's still the case. If anybody from lockets can tell me that. Because lockets used to have an evening clinic. I think that helped a lot with parents who had to work and come home in the evening and were afforded the opportunity to go and carry their children to get simple things like a simple ointment or something prescribed, you know. So I think that model needs to be reviewed and assessed based on the amount of clinics or the amount of population that they have to deal with. And that should probably filter into the overall management and of the patients and the clinics.
Thank you. Just because we've heard this comment before in terms of the overcrowding of the specific RHs in relation to the hospitals. But anyone could answer this. Do you think that there's a clear enough understanding or there's a public awareness need for the population to know what what is required for someone to go to the hospital versus the clinic or the healthcare center, which can potentially have some impact on that backlog issue.
Maybe a educational format so that the population know that, hey, if your son has a skin issue, and you can probably check the clinic before heading to the hospital, and if it's not rectified at that level, then you go further. But I mean, all that would take a little time and probably how to say it, forums like this in more of a direct approach directly into certain communities where heavily populated to bring forward that information. But I truly believe that would help a lot though, because not everything you need to go to the hospital for.
Absolutely. Thank you so much. Any other comments before we move to the next topic on the issue of the management? Yes, ma'am. Go ahead, please. Thank you.
I just came in a bit a while ago. What we are commenting on, because I have several, so I'll stick to the one.
We're commenting on governance, and you can come back again for different topics, sorry. Governance and management of the public healthcare system. How do you think it's being managed?
Well, I have been living in Arima since in the late 80s. I've seen quite an improvement because in the beginning, the hospital was the wooden shack before what they have there as a health center and the hospital. And the time waiting has definitely decreased and the service has certainly improved. I have been exposed to Sandy Grande Hospital, Mount Hope, and Port of Spain General for a brief moment. What I'm finding though is that I do agree with the scans. Sometimes they take long. My personal experience was with a mammogram and I had to go to the I think it's the service department to call it, but it's really the complaints department, right? And I eventually got it. But my personal view is that for what I understand, listening to the COVID information, the volume of beds and stuff like that is a very small ratio. And the services that we have quite a high population of mature people who have to use the services, and the staffing is overwhelmed. I have been in the emergency situation in Mount Hope in the last 2 years regularly, not for me, but for a daughter of mine. And I had to stay there, and these people are working 12, 16 hours. You're actually seeing them there because I had to stay in the emergency ward with her. And they're doing their best. They're the young people. Now, because the older doctors used to put in those hours, they have to do it. If we have burnout of these people, we know for us, even if we make mistakes, we know driving too long, bus drivers are supposed to stop certain times and rest and whatever. And these people are dealing with very critical areas. For that part, I could suggest that you have certain doctors doing the minor things that they would put on the lower triage. And so those people don't wait so long, because sometimes people say they wait a whole day, 2 days to be seen, but their things are minor. And some people leave, or it appears to be minor. So the people who are doing the critical, instead of having them work 12 hours, 3 8-hour shifts. And the other people, we might be able to do 12 hours in is less severe critical type emergencies. That's just a suggestion.
Thank you. Member Singh, you have a question.
Thank you, Mr. Chairman. One question to just close off this, this topic, Mr. Chairman, as it relates to the management structure. It is no secret that we operate in this country with almost a parallel private healthcare system. I'm curious to know from you members of the public, if you all would like to share an experience where perhaps maybe one of you may have been advised by the doctor or nurse or whoever attending to you at a public healthcare facility and recommending, a private facility. Go to a private facility, you might get the tests, you might get the mammogram, the CT scan. Does anybody would like to share that? Because going through the country and speaking to persons, sometimes it appears as though machines or systems might not appear to be working in a public healthcare facility. And it's only because you hear the whispers, it's no secret. Somebody might tell you, well, go down to that office down the road there and their machine is working. Does anybody would like to share an experience like that you've had at a public healthcare facility?
Yes, sir, go ahead. I heard quite a bit of mumbling with that one.
Hi, good evening again. I'll be starting off with patient C. All right. I'm not medically inclined, so my terms may be incorrect. All right, but she's suffering with an issue with lymph, whereby one leg is a lot larger than the other. Right? She has been turned down on a number of occasions for surgery at the Mount Hope Medical Facility. However, it's being redirected to pay $60,000 for the said surgery.
When you say turned down, what do you mean by turned down?
Well, she has all her notes and all her records from when she commenced treating with it at the Port of Spain General Hospital. It has been transferred to Mount Hope, and I'm sensing, because I have not engaged anyone specifically to confirm, but I'm sensing that no one wants to pick up the case. I'm assuming that the situation she has is tricky. And
well,
I think
tricky is why the healthcare system is there.
All right. Well, I won't be able to answer.
So just for clarity, so the patient started at the Port of Spain.
Yes.
And there's a situation that she needs addressed.
Yeah.
And she's transferred to Mount Hope.
Well, not transferred from Port of Spain to Mount Hope.
So she went to Mount Hope.
Yeah, she eventually went to Mount Hope.
And what was she told? She was told that she cannot get the surgery, or the surgery is not done there, or there's no one qualified to do the surgery. What can you elaborate more so we could get some more clarity?
All right. I have difficult to explain. I have all the documentation on my phone, but what I can say is that she is not getting the surgery at Mount Hope.
Who prescribed surgery in the first place? That's what we should ask. Was surgery a course of treatment that was prescribed by a doctor?
Yes.
At Port of Spain?
At Port of Spain, yes.
And so she was referred to Mount Hope to get the surgery that was needed?
No, Port of Spain is saying that you have to do surgery.
You have to do surgery.
Right, but she was not being given even the surgery at Port of Spain. And she is presently bedridden at her home, so she transferred.
I'm trying to figure out what does not being given surgery mean? Was she given an appointment? Was she told the time frame within which she can get a surgery, or she was just told you can't get the surgery in the public healthcare system?
Can't. That's the best.
That's what she was told. Okay. Thank you.
Good afternoon to the panel. Good afternoon, ladies and gentlemen. My name is Deborah Griffith. I want to speak about, I must say that I'm from La Horquetta, and we do have clinic in the morning and in the afternoon at 3 o'clock. But I recently had an experience there that I think I should speak about. I have a 79-year-old neighbor. I'm not a doctor, but I have a relationship with her. She lives alone, and she's losing her memory. One day, her jaw was swollen, and I took her to the health center. When I had to go in with her, I spoke to the nurse. I told her about her mouth. I also told her that she was losing her memory because she didn't even know what she was there for. I had to speak for her. So the nurse, she noted everything. When we went into the doctor, truthfully, he did not even touch her mouth. He prescribed antibiotics and painkillers. He didn't address the situation of her losing her memory because, as I said, every 5 minutes she would ask me the same thing. Every day she comes to ask me what date is.
Did you convey, or did the patient convey to him an issue, a comorbid issue with, in addition to the issue with her mouth, that there was a memory issue that the doctor could have referred her to a neurological specialist or some other doctor to deal with, because he or she may not have been qualified to deal with that particular ailment?
So she didn't even remember that she went there to see about her mouth. So I had to tell the nurse and the doctor what she was there for, and I mentioned about her memory.
So there was no reference from the doctor?
No.
From
So
the specialist?
No. So I was wondering if and she lives alone. So I was wondering if there is some ministry that can do some kind of intervention.
Another question, does she have a medical record document?
In the health center, yes, she does.
And on that document, there is documentation about the mouth issue and the memory issue?
Yes.
And she wasn't referred to someone to check the memory issue?
No.
Okay. Thank you so much.
You're welcome.
Yeah.
Hi, good afternoon, members of the panel, members of the public. I am a patient of the cardiology in Mount Hope at present. Now, I have to do a major operation in June in Mount Hope Women's. So I need clearance in order to get my surgery done. So I was there 2 weeks ago and I need to get something called a dobutamine stress echocardiogram done. And the doctor who was attending to me, he told me that the doctor who was doing the test at Mount Hope left, they haven't found a replacement doctor, and I would have to go private to get that done, and also an echocardiogram, which is $700 and $2,500 for the other tests. I've been calling all the medical clinics. It's like 3,000 and up at each of these places. So this is the one time that they actually said, go to a private facility to get the test done.
So it's an echocardiogram?
Yes, it's a stress echocardiogram. And
so you were not referred to another RHA, which may have the equipment or the specialist?
I asked the doctor at that point in time if he could refer me to Arima because I was a patient of Arima because I had a heart attack in 2022 and I was a patient at their New Arima hospital. But they sent me down there because the stress test machine wasn't working in Arima hospital. So that's why I ended up going to Mount Hope Clinic. So he said they don't do referrals to Arima hospital. Arima don't take referrals from them. That was the response I got. But I went to Arima hospital today and asked them if they do the test. And they said, no, they don't do that test. I'll have to go private for it too, as well.
To be clear, there was no referral to any other public healthcare institution that may have had the machine or the specialist to do it?
No.
Thank you so much.
Thank you.
Thank you, Mr. Chairman. So we now move to access to screening. Some persons would have mentioned certain issues already in terms of accessibility to screening and specialized doctors. But we want to hear from you, members of the public, who live within these different regions that may have RHAs attending to you, whether you have encountered any challenges with accessing medical screening, and if in any instance you would have encountered any challenges or situations where, we refer to them as specialists, where any specialized doctors, you are told specialized doctors are not available or may not, they don't have specialized doctors in the respective fields that you may require to look after your issue. And in addition to that, as it relates to accessibility to screening, whether any of you, and some of you may have positives, but whether any of you would have encountered challenges with accessing screening due to lack of equipment. And I will stop there for now. We have some other questions on the screening, but we now give you the opportunity to ask any questions as it relates to specialists, as it relates to lack of equipment when it comes to your specific screening for your various matters.
So the floor is open. So this is at the intake stage when you go to speak about your ailment or your issue. If you had any issues. Yes, sir.
Good afternoon. Jovan Roberts is the name. I'm presently an outpatient in the ENT clinic at Mount Hope Hospital. And well, I'll just briefly go back to the last topic because with the question asked by the senator, it's actually the inverse in my case. I went to a private institution first and thinking that was the best option for me. The doctor that saw me there, after seeing my condition, actually referred me to go to Mount Hope, because he's also a doctor at the Mount Hope Hospital. And he indicated that given the possibilities that could come out of it, being part of the Mount Hope clinic or being part of the hospital there may be better for me financially, and they have the best equipment there. So it's the inverse of from public to private. I was actually referred from private to public, and I'm very satisfied with the service there so far, because with regards to equipment, again, given the condition, I would have had to do a CT scan, X-ray, ECG, and I've done these things multiple times. And each time it was available.
You got all the screenings you needed, no problems.
And without any waiting, meaning, well, let me explain that part. Whenever I go to the hospital, I take the day because it's a lengthy process, and I try my best to understand it. And sometimes it's understandable given the volume of persons coming in and you want to be thorough. But at the same time, it's also very, beyond inconvenient, it's also very difficult, because when you think about the mental condition of persons coming into the hospital, something is wrong. You don't know what is wrong. And in the process of finding out, you have to wait. You have a lot of disgruntled persons. Sometimes the staff aren't as friendly, but I will say that I have not had any bad experiences with any one individual. But I do see the interactions between staff and persons who are disgruntled, and sometimes it could get out of hand. But specific to access to screening, I would have had all the screening required in time for me to do. I also did an surgery as well, and everything ran smoothly. So that's my contribution. Thank you.
Thank you so much.
And can you just state which period was that? Was it recently or a couple years ago?
This process began in September last year, and I would have had my surgery probably last month. So between September till last month, I've been in and out of the hospital. Sometimes I would have been warded. Most times I'm not outpatient.
Go ahead, member Ford.
Again, you don't need to disclose, but the situation, is it terminal? Is it that, would you say that is a result of what was your illness and so on? That you would have gotten that, because I'm trying to zero in as to find out, like, you have gotten special treatment, right? And well, I tried to zero in to find out, what could have been.
Okay, so
what you think is the reason?
Full disclosure, I am presently the deputy mayor of Arima. Some of the doctors would have known this, but I cannot say for what internal communication may have taken place, but I was never received at the hospital in that capacity. And also, the condition could have been cancerous. It could still be cancer because I'm awaiting. So this is one thing though. The surgery was to remove the problem area and to send it for testing. And in my opinion, I wish I could have had the results any sooner, but I'm also glad because the hospital, well, the doctors indicated that if there's any concern, they will contact me soon. I'm expected to return. My next clinic date is in June. So if there's any issue with regards to the test results, then I would be called in sooner. If I don't hear anything, I'm assuming that all is well. So I wish I could have had the results a lot sooner. But beyond that, I don't feel like it was special treatment.
Did you go through the usual appointment system?
For which part?
For intervention, when you started the treatment, when you had to get your follow-up examinations and assessments, and eventually your surgery and post-operative?
Yes, went through the usual procedure, which is the doctors would recommend a time period to return. If it's 2 weeks, 1 week, 3 weeks. And also,
So as we say in Trinidad, you ain't pulling no string.
No, because when I go there, I wait the 3-4 hours to see the doctor on my clinic day. And that's another issue with regards to, again, I understand the volume of persons that come in on any one clinic day is very difficult to move any more efficiently or faster. But at the same time, again, these are ill people. The conditions aren't great. There isn't enough seating, there isn't enough space, it's very hot, it's humid. And again, disgruntled people can make it even more uncomfortable to be there. But I do empathize with the doctors. I think they move as fast as they can. And if there's any improvement that could be done in the service, I mean, we'll greatly appreciate it, but I wouldn't.
Thank you for sharing your experience.
But before you go, Chairman asked a question. in terms of your intervention and appointment. For your surgery specifically, did you go through the usual appointment system?
For my surgery, because
Or was it deemed emergency and?
because there was a possibility of cancer, because it was very irregular behavior with regards to the problem was the problem that existed, and medical terms, or not medical terms, in layman terms, the doctors said that it's behaving very irregular and it's a high possibility of cancer. So to make sure that it was not that, they decided that we needed to proceed as fast as possible to determine what is the...
So they try to be preemptive.
Yes.
Thank you so much for sharing your experience. All right, we have a young lady coming up to the microphone. Take your time, take your time.
Good evening, everyone.
Good evening.
My name is Lynette Moore. I live at Larry Sus in Dabadee. I had prepared a document to read out because I didn't know how it was going to be. This is my first visit at any one of these activities. What I would like to make a comment on is the screening. In 2022, October, I was watching the news at my home and I felt a discomfort on the left breast. So went and drank ginger tea, blah, blah, blah. 11 o'clock, this thing is still bothering me. So I asked my son to take me to the Arima Health Facility, which he did. And as I got there, I began to realize that I was having a serious breathing problem. I was taken into the inner section where the doctor on duty, a beautiful, petite, young woman, dealt with me. I was put through the ECG, the chest X-ray, something else. And she told me, to my shock, you've got a blood clot in your left lung. So I said, what? I thought I was going home. She said, no, if we don't send you to Mount Hope immediately, you are going to die. I was transported by ambulance to Mount Hope within an hour. There I was put through the regular process at Mount Hope. Then I had the CT scan done the next morning, and I had to stay a week. I was given subcutaneous Clexane injections, which cost a lot on the open market. I wish to say that I got wonderful treatment that night and during the 7-day period at Mount Hope. I then became an outpatient with the chest clinic at Mount Hope. And after about 5 months, the doctor who dealt with me at Mount Hope said that you can stop taking the Clexane and continue life as usual. I must say that I got good treatment. I have much more good to say. I hope I have an opportunity, but there are lots of people here who might want to say what they have to say. So I hope I'll have another opportunity because there are other things I'd like to comment on.
We're glad. I can listen to your voice all day.
Oh, good, good, good. So shall I continue, or to be fair?
We will have you back up. Thank you so much for sharing.
Thank you.
Thank you.
Okay.
Member Mohit.
Thank you, Granny. And, you know, we really appreciate your comments. You are very vibrant, I must say, and you really spoke before my next question. And I'm glad for your comments in terms of us believing that public healthcare systems do provide adequate customized services for our elderly and those persons with disabilities. So I know under disabilities, there may be persons who have family members or friends that you may wish to comment. And one additional question in the interest of time, so you can ask as we go along. We have a lot of men in the crowd. So I know in terms of screening, some women may have views on your husbands, brothers, fathers, and so on. So whether there are any suggestions for the encouragement of men to embrace screening at the RHAs.
Thank you, sir.
Good evening.
Good evening.
I'm Von Clark, and I am here to address one of the matters that you will bring forward later with regard to the availability of medication and so forth. However, on the point that you have just raised, I have found, I have been in the healthcare system since 2016. It's been touch and go, both good and bad. At one time, I was hospitalized because of cardiac issues. I belong to several of the clinics in the outpatient system of the healthcare thing, urology, cardiology, and so forth. What I have found in terms of being able to access the system, which at times can be extremely frustrating, is the ability of one to recognize where you are at and that you're not the only person whose situation is critical and needs to be attended to. I have found from my own experience that I have had to befriend rather shamelessly at the time. I have had to befriend the female members that, of course, overpopulate the system. I've had to befriend them. I have what is now I can call a V-force. My name is Vernon. I call it my V-force. It's like a, what's that term? A Dora Milaje of women who look out for me. How did that happen? Because I accessed your screening and befriended your staff rather shamelessly to ensure that the limitations and the overwhelming of the healthcare system that I am trying to access can work for me. When you get to the point where you will be addressing the availability of medication and that sort of thing, I will like to have the opportunity then to return to the mic so that I can read to you my prepared statement on that issue.
That's coming up shortly. Thank you so much.
Very
and
well.
Also, not everyone may be as charming and as handsome as you.
That Dr. Paul is not my fault.
Thank you so much. Sir.
Yeah, so good evening, members of this esteemed committee. First, I would like to commend this initiative. Very, very informative. I'm learning a lot so far. So my contribution stems more or less of a recommendation and screening. So my name is Jeremiah Masura. I'm a research student and the vice president of the Postgrad Association at the UAE. And I want to encourage or at least recommend that there is a greater linkage between the research provided on screening, right? So I will just give a little insight into what my research is. So I test kidney stones and I test for composition, and I link the composition based on what I find. So what could potentially be the root causes of urolithiasis in kidney stone patients in Trinidad and Tobago. And we saw earlier in the excellent presentation, we see diabetes and heart disease, I think hypertension and so forth. All these issues has screening attached to it, right? And I would be the devil's advocate saying that there are a lot of existing research by researchers, not only at the university, but students who go abroad and so forth. There's a lot of research done on diabetes and so forth. And based on screening and so forth, and all of this research could be used, in my opinion, to assist healthcare professionals. And it has been done before. but to assist healthcare professionals in terms of treating reoccurrence, treating anomalies, and just overall education in terms of that, right? I have learned recently how to use CT scanning and so forth. And in terms of that, I have realized there is limited specialists in certain areas in the field, right? So that's just based on what I have experienced, right? So that's my contribution for now.
Thank you so much. I'd just like to acknowledge the attendance of MP Lisa Morris-Julian. Thank you for being here. And also His Worship, the Mayor of Arima, Mr. Maharaj. Thank you for being here also. We're going on to a good segue to the Member of Parliament for Arima. Member Beckles, you're on.
Thank you very much, Chair. And again, welcome. And thanks everyone for attending in your numbers. His Worship, the Mayor, and my colleague, Lisa Morris-Julian, Member of Parliament for Deputy Mayor, all the councillors. And those of you who are even not from Arima, happy to have you here. So this deals specifically with the issue of treatment, access to treatment. And again, we speak about the issue of challenges, but we're speaking specifically on the issue of dialysis, cancer, hypertension. Can you speak of any challenges you have experienced? And also as it relates to surgical procedures, and have you encountered a challenge with accessing treatment or keeping appointments due to the lack of equipment at a public health institution or staff shortages? And I'll come back again. So
the floor is open.
Thank you.
This segment is, and I know some people may have spoken about it before, shared before. This is access to treatment in terms of dialysis, specifically cancer and or hypertension or any of the three. And if you have encountered a challenge in accessing treatment or keeping the appointment that you may have been given at some point. And did these challenges deter you in particular? Well, we're really happy to see so many male members of the population out this evening, because generally the audience is filled with females. So let's congratulate the men for being here today. And what has the experience been, or what have the experiences been with the men with access to treatment? Anyone? The floor is open.
Okay, so I know some of you spoke already. So if you have anything to add. Okay, so whilst you are thinking about it, so let me just go on to a question that is, do challenges in accessing treatment from public health institutions deter you from seeking medical care from these institutions? We recently heard that men shy away from health facilities. Do men need to be specifically encouraged to improve their propensity for accessing the health system? As Chair said, I think this is one of the few occasions we have had so many men attending. So please, we would like you to comment. Thank you.
Thank you. You have to represent well, right?
Pleasant good night to the head table, Chairman. My name is Clarence Mendoza, and I've sat there for a while, and I really wanted to speak on each topic because each comes together as one. And I'm saying that because for me, management is a big problem on all what the questions you are asking. It's management. And I ask myself, is it really management, or is it because, like the gentleman would have said earlier, it's an overcrowding? And I'm saying that because me specifically, I would have gone to my private doctor. He would have recommended me to join the clinic. I would have joined the clinic. The clinic would have sent me to San Fernando General Hospital to get an appointment. It took 8 months. Okay? That's my problem with the healthcare sector. Appointments. When you get an appointment, it takes 8 months before you go back. What's the problem? Screening. Talk about screening. Same thing for me again. Screening was set up. Reached the San Fernando General Hospital. They gave me a date. The date, I went there in February. My date is June 20th of this year. Okay? That's one aspect. And I'm saying that because if we are to go to the health center or to the hospital to get these appointments, it should not have been that big window.
So let me ask a question. How did that make you feel as a patient who, because most people who go to access healthcare would have a problem that they think in their minds needs immediate attention. So when you get that protracted appointment, what is your thought process at that point?
My thought process goes back to the gentleman you would have mentioned earlier. It came under screening, okay? In 2022, my wife had developed dementia. So this is my first time going out into the health sector with her. Our family doctor would have recommended, same thing again, take your wife to the mental clinic. I said, okay. He gave me the recommendations. I would have gone there with my wife. I would have sat there for 2 hours with my wife. Then a lady came. She said, okay, Mr. Mendoza, bring your wife. This is your date. 9 months later, that's what the appointment was for. 9 months from that day, I was to bring my wife back to see a specialist. 9 months.
What's the interface like at that point when she was there before the appointment?
It had no interface, none whatsoever. No doctor was there.
So she didn't get any examination or
nothing, nothing. I got the examination 9 months later. But let me answer the question Avinash had asked. And that's why I'm saying when we talk about the healthcare center, we all go there. Some men don't want to go. I didn't want to go.
Why?
Because I think it's a waste of time for me to sit there for 5 to 6 hours and then you tell me come back 6 months or 5 months later to tell me what's wrong with me. It's a problem. So that's why I'm saying when Dr. Avinash had asked the question, it fall in my garden. Because when that healthcare attendant dealt with me, when I was walking out, she called me back and gave me a business card. She gave me a business card and she said, you can go and see a doctor at so-and-so place. And I can tell you where. GovView Medical.
But that's not called medical.
Oh, no, well, I am being real and okay. I hear you.
But
we'll keep the names out. But this is what would have taken place. I said, so when I take my wife there, how much do I have to pay? He said, maybe $4,000 or $5,000. Some, it might be more, it might be less. So I'm walking out here with my wife, who has just been diagnosed with dementia. You give me a 9 month to come back to see a specialist. And then you're telling me I can go here if I want it done faster, but spend $5,000. So what are you telling the whole healthcare sector? What are you telling me? You're telling me not to even come back to see you because it'll be 9 months. So within 9 months, I must know what's happening with my wife. What's going on in her brain? How is she thinking? How is she feeling? And that goes for anybody who is.
And what level, what can you tell us about the person? Was it a junior person, a mid-level person, a person who has a high position in that institution who would have tried to refer you to a private healthcare sector institution?
Well, I cannot say if it's a junior or from middle management, but that was the person who was working, just taking your orders. A lot of people were there.
So this was the intake person?
That's correct.
Who
at the front desk.
So you saw no medical?
No.
And that person tried to refer you to a private healthcare institution?
That's correct.
Wow.
That's correct. It would have happened to me quite a few years ago at with the dentist. Same thing. I would have referred to a dentist who works in the hospital, but to go to his private clinic. So I am saying this because this is deterrence for many of us. I don't know, for me. I would have ended up having to fly my wife outside the country to get immediate medical assistance.
I'm going to ask a very pointed question. Do you feel a sense of exploitation in that situation?
It is, because it happened too many times in different sectors, in the dental sector, and here it is in the mental clinic. I don't know about other parts of the hospital if it's happening, but if it can happen there, it can happen everywhere else.
Thank you, Mr. Mendoza.
You're welcome.
One additional question. Both you and your wife, are you still in the public healthcare system?
I am. I took my wife out. I took my wife to Canada. Right now, my wife is sitting in Canada. She's getting medical treatment there for the dementia, and she comes in.
Would you say you were forced to go to Canada?
Yes, I was. $5,000.
Thank you, Mr. Mendoza.
Hi, my name is Monica Lewis. You all asked about how we could probably get men to come. Can't say for the older men, but certainly we could do it in schools where we start educating children about timely medical checks, dental checks, and so on. So that's my contribution with regard to that, that you start opening their minds to seeing about themselves, because even as children, sometimes we as parents, they have a toothache or they're feeling unwell, but it might very well be something with their teeth also. I understand teeth could also poison your body if you have cavities and so on. In terms of treatment, even though it's not specific to what treatment, you all talked about cancer and stuff, access and screening, I have found those times as I've gotten older and had to be rushed to the hospital, they will run the ECG, chest x-ray and stuff like that. I have a daughter who has a little mental issue right now, and they've run blood tests, CT scan in Mount Hope, very efficient. That's within the last 2 years. And they had a surgery to do with some sort of abscess, very good treatment. And the doctors, young doctors, they're explaining and so on. With the IPU unit though, I found I had to ask for the consultant to be able to get a little more dress. I think because of reading a little bit on the internet and so on, and also talking to the consultant afterwards, that mental issues could be as a result of physical issues. I think the screening process at the initial intake for the psychiatrist to see, maybe a little too limited, but it is all right for a screening process. But by the time you reach the psychiatric unit, I think they need to follow through with other things in case you're putting on people on psychotic medications that might keep them there, and it might be really a vitamin deficiency or some other something. So I think, because I found I got some resistance, but it's not the consultant, it's coming from the lower end because I think they're a little overwhelmed. My mother, who's 83 years old, God bless her soul, next month, she has a heart issue. She lived in the States a while. She was admitted after the terrible smoke situation in the early part of March, breathing issues, and she was accepted at the Irima General Hospital, as they say, the Hyatt experience. However, they sent us with referral letters, one to the lifestyle clinic in Arima and one to Mount Hope for the cardiology. I went down to the cardiology to get the cardiology appointment twice. They told me, no, come back to Arima. So I had some transport issues. Eventually, because my mother went back a following week with a similar breathing issue after spending a week in Arima Hospital, they said that they didn't have room for her here, so they were sending her Mount Hope from the night into the morning. And down there, they said they're going to do another blood test, and they cleared her and just sent her back home. Only when I took their referral letter to the cardiology, they accepted me there. But they would keep sending me back with the first one from Arima to say, Arima have cardiology clinic. So there was a little tug of war there.
So do you think that there's in terms of the management and the overall treatment experience, there was a communication and coordination issue between the different health institutions if there's a transfer referral?
I gathered because there's a transition of new services at the Arima Hospital, there may have been a communication problem. They told me if I could find out the name of the person and so on, I didn't bother to try to figure out who was the problem. I just got the appointment and I said another time I'll go with the other letter, but that hasn't happened because it's recently. What happened afterwards though, the Arima Hospital said, we'll still see your mother in the interim because they know it takes a long time at Mount Hope to get an appointment. Because what I got was, here what, they're going to call in about a month or 2 months' time to give you an appointment. As luck would have it, I got a phone call today with a voice message. The appointment is in June 2025.
June 2025?
Yes.
And this is for a heart condition?
Yes. And the thing about it is... The
person is an elderly person?
83. However, the little thing that happened in Arima is that when they saw in the cardiology center, they were telling us to do the echo. And the echo machine was working for some time. I don't know if like photocopy machines, they have to be serviced after a certain number. And I know the healthcare system has a high volume. but they said it wasn't working. Now, there's somebody there who I used to work with in the bank, and she was able to tell me, yes, it's not working. So it's not, I don't think it's anything, it is a real issue then. It's not working properly. However, we went and paid for it, and I called and I said, because they didn't.
So you went privately to pay for it?
Yes. Right? They didn't tell us, they told us that there were 1 or 2 places in Arima. We just selected where we wanted to go. However, I called and I used the phone line and asked the Cardiology Center, and they said, 6 weeks time, we'll get an appointment. And I took that appointment, and then I went in physically a week later, say, could you show the doctor this for me, please? Because I can't read that. I can read blood work now, but this was unfamiliar. So I said, Dr. Ryan is a person. Could you ask him for me? Could we see him before? And we got it for 2 weeks 2 weeks from the time we were supposed to do echo to seeing them. And he said her heart is operating at 35%. So she may not make it this year. So by the time the appointment comes up, but anyhow, I also have a cousin who is in her 50s.
I'd actually put a pause.
Sure.
We want to move on. Thank you for sharing, and we hope that that situation is expedited because it doesn't sound like it's an optimal situation. Thank you so much.
No, but my cousin had a heart attack. She was given a 2-year appointment. When the appointment came, they asked her if she had any pain in her chest and so on. She said no, and they said the next 2 years.
So she had a heart attack.
Was got whatever treatment, medicine, joint clinic and stuff like that. That's a few years ago. But when the first appointment came up, they asked her and they said they put her another 2 years.
Wow. Thank you for sharing. Thank you, Member Beckers. Member Naked, you can go ahead, please.
Good evening, everyone. Before I continue with the access to medication, Chairman, I just have one general question. Since there were so many varying accounts and experiences that are pretty much at odds with what we saw before. So I have one question that I don't know if has been covered previously. What are the expectations? Do we know as a community, what are the expectations of our RHAs? Can anyone, just 1 or 2 people before I go into access to medication, does anyone can give me just a synopsis of what are your expectations of how our RHA should function?
It's a very good question.
Pardon?
Well,
come so we could maybe have a...
And if you could elaborate, I think it's a very good question. What are your expectations when you go to an RHA institution?
Right, thank you again for the opportunity. So my expectations, well, I'm trying to speak on behalf of people that I know who have visited the RHAs. Of course, time frame, based on the emergency, it can be a situation, like I remember coming into the healthcare sector with a bus had a laceration and 6 hours I had to wait for treatment. So definitely the time frame in which emergencies are treated, in terms of advice, in terms of preventing reoccurrences, any historical background to assist the patients in changing their lifestyle, and thirdly, general assistance and support, right? But my experience in the RHA when I'm still young has been positive, right? Whenever I have to come to get treatment and so forth, has been positive. But speaking on behalf of the older folks I know who have had expressed negative opinions to me. So that's just my take on it.
Can anyone, just one more person if you can, just to have an idea of what we expect? Yeah, why not?
Good evening, everyone. My name is Michelle Omar Laiba. I am from Chaguanas. I am now the groupie of this group. And Lady Penelope, you're awesome. So it should run as a well-oiled machine. From the minute you come in as an outpatient or emergency, everybody should know what they're supposed to be doing. From the clinic part for the customer service, which we lack in every aspect. I have over 40 years experiencing customer service, and every time I have to go to the hospital, it's like, boy, here we go again. From the time that you have to park, I have asthma, and I have to park in the car park and then walk and probably die by the time I reach the roundabout. And then walk again to get into the clinic to be told, oh, well, you know what? We still have to give you an appointment. A well-oiled machine, that your machinery is working and that the staff, which is the doctors, are not telling you, well, the CT scan is not working, the X-ray machine is not working. So I would recommend that you go to the nearest private institutes. When you go into the clinic for the eye clinic, doctors should not recommend that you go to private hospital and then turn around and tell you, these are the ones that I would like to recommend. And when you go, there's a form that will be filled out and they will be given to the ministry, which is the norm in those private hospitals. It is all over. The specialists in the hospital will tell you, well, we can't function today, but you can come and visit me at my office in another private medical institute. This I can say for facts. And as you said, Dr. Richards, not to call names, I won't. I have been to the NR, to Mount Hope. I have been to many institutes in St. Augustine, in Valsine, in Port of Spain, and in San Fernando. We need to stop allowing these specialists to run your hospitals, our hospitals, the way they want it run, when you should remove them and put doctors in there who really want to look after us. And we need our one card. The minute I was advised after the meeting in Chagodas that the Ministry of Health gave out a card, but you get nothing out of the card. It's just a card. This should be accessible with all my information on it. That's all we're asking for. And for the gentleman who got through, you were special. You got through very quickly, you were special. I wish I could be special like you. Because up to now, this is the second month that I've gone from my medication, from my high blood pressure, and was told on a CDAP, we don't have any, but you can buy it because I need it. I have to now buy it privately. In the same drugstore, that is given a CDAP. Now, this drugstore that I go to, they have several franchises. So I'm saying, can you call the other franchise and see if they have it? Therefore, I could pick it up there and they say, no, once you stop here, you can't go anywhere else. And then they will tell you, oh, the machine not working, see that system not working. That is what we need to see, Mr. Hackett, a well-oiled machine. And if we get that, that is 90% of our people being alive today, no matter the age.
Do you feel, it's Michelle, right?
Yes, sir.
Do you feel the gaps in the system are being exploited?
Yes, they are. Yes, they are. And they're being exploited by the doctors in the hospital who have medical clinics. And everyone could say here, look at over the past couple of years, how many new medical clinics have come up? How many new medical eye clinics have come up? And I'm talking real. So why can't we have a real good system for cancer? Because the private institutes now are giving it and you're paying $15,000 for one medicine. We need to brace facts now. If you want to work in the hospital, there are ways and means that you can do it. But you have to be very serious. And you know what? Fire all of them. Bring in the foreigners to run it as a well-oiled machine, and it will be done, and the nurses as well. I will walk with my walk and stick with it too.
I don't know that I can endorse fire all of them as a way to move forward.
From the speaker's point of view,
But
but honestly, they are doctors and they are doctors.
I understand where that sentiment comes from. It comes from a sense of frustration.
It is, but I will also say this. Give jacket to a few of our politicians who are doctors. And you see Dr. Rai Ragbir, I will close my eyes for him because he's a fantastic doctor, whether private practice or in the public sector, because he knows what it is, right? And that is the kind of man I would like to see running our Ministry of Health and get things done. Because he gets it done not only in our constituent, he's not even a member of parliament.
Okay.
But I'm not going there. But anyway, we're going to continue. Dr. Richards, what you all are doing here, as you can see, I was at Chigonas. I'm about being real talk. And if you all sitting down here now, not getting up from where all you're sitting and be honest with this panel here, then they're not going to be doing what they're supposed to be doing for you all. Thank you.
Okay. I just want to also speak in relation to.
Come forward a little bit, please.
Okay, yes. I also want to speak in relation to the doctors. I don't know if it is that they are overwhelmed. Again, I'm speaking in relation to cancer patients, is that a lot of times you need information, right? So they tell you it's breast cancer or prostate cancer, and you have a lot of questions, right? And some doctors would sit down and listen to you. I have heard people say they tell you, Google it, right? And then when you get any treatment now, as you go through your treatment, there are a lot of side effects that start happening. And you go and you ask the doctor, well, this is happening so and so. Yeah, that's a common thing. That is okay. But you have your own emotional and to deal with. And this is where, quite frankly, we as other cancer patients, cancer survivors, have had to help to boost others, because the kind of support that they will get from the medical professional is not consistent and is not there.
Thank you so much. Lady Pink and then Member Naked, you can continue.
I think the hospital may not be being run like a real business. If we need to evaluate, you need to look at your statistics, your volume of people. And yes, you can have a complaints area. They do have an anonymous box, I think, for suggestions. But it's great that we have this sort of forum. But there's so many people who may be experiencing things that you could identify if you have an anonymous place to email or so. I know we're talking about how best we could work the system to what we expect. So I think we need enough staff, because we have some nurses and doctors who have left the country. Might have been the better ones. But some other thing is going underground if we're hearing people complaining that they're referring them to their private businesses. So we need to try to unearth why that is happening. We might be able to tell you what the experience is, unearth why that might be happening. Look at the statistics, the volume of people going in. They must have some sort of records. I know we're going digital, but they must have some sort of number files. Okay.
I think we're all aware of what's happening. I think we know why it's happening. I think the system needs to be put in place so that the gaps in the system are not exploited at the expense of you, the people. That's what needs to happen. We know why it's happening.
I have one other suggestion though, in terms of teaching children and even in the workplace, first aid, and being aware of safety, not leaving cords and stuff on the floor or whatever. That helps people have less accidents. As I said, the dental and medical, helping them be aware in the primary and secondary schools to follow up and check. Because when you go into the hospital, sometimes when my children were young, I already gave them Panadol, they have fever and whatever, but other people, they're children crying and they haven't done anything. And then they have to go under the cold water with the child screaming.
We're coming to the public awareness, but thank you, Member Naked.
Hi, good night. So I'm a little more familiar with the CDAP system because I've been a user and a dispenser of it. So what used to happen in the hospital before there was a digitized system? If someone would get a prescription from Grandy, and let's say it has 10 items to get, Grandy would issue what they have, and then the customer will have to go and look around to see what else is available in the various other hospitals. Through the digitization, we can now properly identify what was dispensed and no longer redispense it. Because there was an issue where some patients were actually hoarding medication because there were times when it would just run out and you didn't have any. So everybody wanted to keep a backup, so to speak.
How does a patient hoard medication if a prescription is for a particular amount of time to treat a patient?
It's a piece of paper that would just go around the system. And if the ERHA dispensed it and didn't mark it off because they were busy, they could go to NWRHA.
The patient is not
and
at
have it
fault.
received.
The system is at fault.
Correct. So what CDAP helped to rectify was that when they issue a month of medication on the system, it cannot be issued an additional month. There's a gap where you could refill within 3 days before it's due. So that system helped rectify that issue. The way CDAP works currently is that it measures a pharmacy's output and delivers medication based on that. So it's an efficient system. CDAP is working. NIPDEC's ability to provide medication is the gap that we have in, because some medication through sourcing is difficult. They may be sourcing it in medication and saying, well, this is a good supplier, and then that supplier falls short. It takes a long process for NIPDEC to retender and
Well, while I understand you're going into the belly of the machine, this is not the experience of the people who are sitting here or the wider public. So while I understand there are reasons for those deficiencies in the medication, that is not their concern.
So I'm going to get into the problems that we are having on the CDAP side. So at present, insulin, we have a batch of insulin expiring in a few days. And we have no insulin to dispense. No emergency button was hit in NIPDEC to say, hey, insulin expiring, this batch expiring, do the recall.
So there's what you're describing to me, and this is just a part of the situation, is that there's a are you suggesting there's a lack of proper coordination for the supply-demand issue with these specific medications?
It may be that case, and then you see the hospital is a whole other beast by itself in terms of stocking, because a short plenty of them going to come up and say, the doctor writes in Atacan. When they go to the dispensary in the hospital, it's not available. You have to go out and purchase it. They get inferior medication, a lot of it coming from India. They're feeling as though it's not safe. But then again, awareness is not being presented to the population as well, right?
Stick up in right there, so we could continue with the question, because you spoke about the unavailability of some medication.
Yes.
In those circumstances, has anyone had the experience where you propose alternative medicine if you couldn't get prescription drugs? And I like that for the larger audience, rather than anyone propose that you seek alternative medicine?
Come to the microphone, please.
Now, this is how CDAP works. They get a book. All the doctors have a book, has a list of all the CDAP drugs. The doctor writes out what it is. The doctor will then tell you, if you go back to him and say, listen, I'm not getting this drug all the time, then he would say, okay, try this one. But what they're trying to do is there are many of us who are in middle to no income families who cannot afford these drugs. So you take it to the pharmacy and they will read it out and they would tell you, okay, you have all, but we don't have this, come back again, try back again. But if I get, like, for instance, my high blood pressure, they still owe me 2. I have to go for 6 months, so they still owe me 2. So now I have to buy. So it's not that the doctor is going to recommend. The doctors who recommend are the doctors who are in the private institute. The doctors at the hospital give you a CDAT form. And as to NIPDEC, I've been there, done that when I was working in the Ministry of Health. That system is totally different. But you get a form stating, and if there's a generic brand, the drugstore will tell you, well, there's a generic brand that we can let you buy. But then again, I still have to buy it. So that is the whole thing. So this form that they're signing out, why don't they now put the generic brand also on that form? But it's a long form, but a lot of the drugs that should be there are not there. And that's another thing. So I'm going to move again.
So with regards to CDAP again, it was tied into the health card that she was speaking about. The health card was supposed to be a national card with all your data on it. So it would have her history in a database. So should she fall ill in Port of Spain and goes to Port of Spain General Hospital, he has a health card. No, but well, it was supposed to be used nationally. So as well, she has a problem in Port of Spain. When Port of Spain scans her card, they will see that she's an outpatient, that so on, so on. She has heart problems. This is her medication that she's using. This is her blood type. She's allergic to so and so. That was the intention of the card. I can't say if that card is still ongoing or if it stopped. And also, I don't know if the Selma system, which is what we use for CDAP, if it's tied into the hospital system so that we could help remove some of that paper and cost. We were talking about equipment availability.
No, let's stay with the
access to medication.
Remember, before you have an intervention, then remember that you can continue.
I just want, now you talk about, as the chairman was saying, you went into the belly of the whole situation. But for instance, I am on CDAP.
Right.
I have 10 tablets to get.
Yes.
I get 5 at Grandy.
Right.
Can I go to another location to
Yes.
get the other 5?
Any pharmacy that does CDAP, you can go to that pharmacy and access it. If let's say a pharmacy has 3, you can go to another pharmacy that dispense CDAP and get the other 2.
Is that working members, people?
Come on, one of them. Okay, all right. Hello, let's not a debate. Let's have some order. If you want to make a contribution, please come to the microphone. It's not a debate between the person on the floor and the other people. Okay?
As someone who's in the system, that's how the system's supposed to work.
It's
Because
supposed to.
if I am at my pharmacy and I want able to dispense 3 items, I will either call.
So while I accept that that is your experience, what we're hearing it is not everyone's experience and the receiving it.
Some pharmacies not giving everybody
But right, well, what we're saying is we're here to listen to everyone's experiences, not justify your experiences working.
Yeah.
Okay? Member Nakil?
Yes. Has anyone faced challenges with the shortages of cancer drugs at cancer treatment units?
This question is about access to medication under the rubric of cancer drugs. I know someone would have referenced, I'd like to acknowledge the presence of the chairman of the Sunapunapiyako Corporation, Mr. Josiah Austin. Thanks for being here. And Grandy is here as well. Thank you for being here. Anyone has issues accessing cancer drugs? Member Nakin?
No? That's very good.
That's it, member. Absolutely. Go ahead, please.
Right, good night, everyone. Good night, members of Parliament, Senator. My name is Crystal Hussain. I just wanted to share a little situation about one of my really close friends who's actually diagnosed at stage 4 cancer currently. She had a biopsy done at the Grandy Hospital, and in getting the results, they didn't do it to specific labs. Sorry, they did not complete it at lab specifications, and she actually had to go back in to do it again.
What does that mean?
That means like when she took out the biopsy, the little pieces, and sent it for testing at the labs, right? She actually did it privately because actually it would take approximately 6 weeks to get the results. In getting those results now, they didn't test for a particular, I think it was a particular.
Okay.
Right. And they had to go back and get another biopsy done in order for it to be tested. So she was saying that it was.
In the San County Hospital, you're looking.
Yes, it is. And it has been very traumatic for her. She's actually now seeking help in the US. She's actually doing an emergency flyout on the 7th of April to get her probably further tests on her breast removed. Her doctor actually advised, because of the waiting period, to get this these results, it will waste her time because of the stage that she's at. Because they're actually seeing it moving to her arms. And I think this is critical.
It's quite advanced.
Exactly.
And in spite of it being a stage 4 diagnosis, she was still being given a long period
of time.
Surgery,
yes. And she had to do the same thing, an echocardiogram, and the appointment is in December 2025.
For stage 4 cancer.
For stage 4. And it's written urgent on it.
she was asking and questioning all that. She's in a mess currently. She's trying to get out as fast
So
as
what,
possible.
so what is, because someone asked the question earlier on. Because in addition to your primary complaint or issue, the issues that we're identifying, and we've had some good responses also, some positive experiences, that does something to your psyche,
It does.
which in turn has another effect on your prognosis, because then you start to mentally, psychologically cascade.
And we know the effects of stress on cancer cells. Also, I also advised her because of limited chemo drugs, and that's why I stand up and talk to you, that she should fly out, because they will tell you you have a chemo appointment, and then that's what he advised her to do. They will have a chemo appointment, if drugs wouldn't be available. And at sometimes when you do get the appointment
And this is a doctor in the public healthcare system advised her,
yes,
seek some international help.
yes,
Thank
she's
you.
leaving. Yeah.
Great to see you.
Okay, great
She's
to
a
see you.
former student colleague of mine. Member Ford. Yes, thanks.
Okay.
Hi, good night. My name is Darren Daniel, and I've been hearing everybody comment tonight. And I think one of the problems what I have been hearing is management. Management is a serious problem that most institutes can't handle. In some instances, simple solutions could take care of the problems that we are having here, especially in the healthcare, paternity, and sometimes transparency. People, from what I have seen, people need to be responsible for their actions. You get a job to do, make sure and get the job done to the best of your ability, because at the end of the day, it's lives you're playing with. From what I have seen and observed, you see the elderly, the young people, I think when they come to institutes, I think attention should be thoroughly they should be treated kind of a matter of urgency, because I mean, senior citizens, I have went to the Grandi Hospital and I would have experienced senior citizen lying down on the floor of the hospital. I went with my own son and I was very embarrassed, because after staying there for about an hour, I was told by the security who was in the hospital, this is making sense. It's best you leave here and take your son elsewhere to a private institute. And I found that was very unprofessional, and not even a doctor. And I see people lying down almost in filth who couldn't handle the stories. I just say, so that was unacceptable. That was one of my experience. So in terms, we see a perfect example with young babies dying at the moment.
That's
right?
topical,
So,
but we're not going there.
so some negligence taking place. Yes, I fully aware of that.
That's not the remit of our
I fully aware of that, but I just joined. I just saying we have to take it. I mean, it's a sad situation, but it's reality. I know we're not here to talk about that, but I must bring it up because that is what's happening presently. So we have to, if we want change, we have to start getting more serious. People have to hear the concerns. Look at what it takes for you all to hear our concerns right now. You having something privately. You're all supposed to have something in place in the hospital, just like every other institute, where if people not doing their job, they will get disciplined. They have to get some disciplinary action, some sort of things. I haven't seen a lot of people.
You don't think there's accountability for people not doing their jobs?
Of course, yes. And people not getting suspended, people not getting, everything is being swept under the carpet. And that's my contribution. I'm totally disappointed with that as a citizen of Trinidad.
Thank you.
Thank you very much.
Thank you. Member Ford.
Thank you, Mr. Chairman. Okay, I'm going on to patient record management, part of it.
Sorry?
Anything you say that?
Prostrate medication. Yeah. One of the leading acknowledged causes of death among our men is prostate cancer. As you may know, BPH, benign prostatic hyperplasia, or non-cancerous prostate enlargement, happens to almost all men as we age. The incidence of BPH and prostate cancer is higher in men of African descent than it is in other races. Consequently, the work of the urology clinics of the Ministry of Health is of major importance, as can be attested to by the alarmingly high numbers of men in our clinics. The use of the drugs Avodat in conjunction with Flomax and Deodat as an alternative are of paramount importance in successfully continuing treatment of BPH and are routinely prescribed by the public healthcare system. The monthly cost of these drugs can easily get up to a budget of $1,000 and more. Therefore, there is an extremely high dependence on the supply of those drugs by the public healthcare pharmacies. Nonetheless, the supply of Avodat and Duodat by the public healthcare system is as abysmal as you can imagine. If one is successful in receiving prescribed quantities of the drugs 3 or maybe 4 times in 1 year, I repeat, if you are successful in receiving prescribed medication of Avodat or Duodat 3 or maybe 4 times in 1 year, then a miracle has occurred. It is therefore clear that we need to understand that the lack of the use of this medication creates a situation in men who are only suffering with BPH that takes their PSA readings to out of calculable or anticipated levels. Their PSA readings just go out of whack. And the complications that set in thereafter is stoppage of water or maybe even prostate cancer. The Ministry of Health and our public health care system has to address the provision of Avodat in conjunction with Flomax and or as an alternative, Duodat if our men are to be saved and if the public health care system, its emergency and hospital facilities are not continued to be overwhelmed by men chasing after their systems that has gone awry because of the lack of the provision of these 2 particular drugs.
Thank you, Mr. Gwynn. Can we leave it there for now, please? Thank you so much for sharing. Member Ford.
Could not have said it better. Thank you. All right. Patient record management. We'd like to find out any challenges, whether positive or negative, with regards to persons going to various health clinics and probably having their records being misplaced, right? We probably would have had a file. Now it's supposed to be done digitally. Do we have any cases along those lines from individuals? Again, you all can take the mic.
The gentleman in the green first and then, yes.
Yeah.
Okay, good evening, everybody.
Good evening.
First, I would like everybody here to say thanks to the board, the people up there. We have PNM, we have UNC, we have independent, all of them. God, first time up. Yeah. No,
thank you for noticing.
My contribution here, it concerns ARIMA people. But no, we're dealing with air pollution in ARIMA. We start with the landfill, the dump, we know it as a dump. That's there since 1964. Normally they start to light it a fire and the whole town is smoke. Now they turn it into a landfill. When rainfall, these fumes go up, it come over the town. We have gardeners. The chemical, it go up, it mix up there. Vehicle, the airport. Then we have an industrial estate right down Omera Road. All that pollution going around and mixing up over the town. People are affected. ARIMA boys, government. ARIMA girls, government. ARIMA boys, RC. ARIMA girls, RC. Holy Cross, ANG, ARIMA new government. Presbyterian, Malabar RC, Malabar government, Malabar. I could go on and on. All the school, I didn't know time for no preschool, then primary. No, we need people to address these things before people get sick and no cancer, medicine and things. And next thing too, this is very important. The Mausika River is the most contaminated river on the east-west corridor. A test was done by WASA with our Doppler River program. Then there's our next river run off from the dump. They call it Kobo River. People taking water from that, water in produce, and bringing it and selling in the market. We try to get meeting, well, the mayor of ARIMA at one time, she gave us a hearing, but to address the concern, it failed. People from up in Kobo River coming along and say produce in the market.
Can I interject, sir? 1 second. 1 second. I understand that you have a lot of issues.
No, let me
finish. With pollution, which can be a cause of cancer, and with other issues in the borough. While they are extremely important, and I don't want to invalidate your contribution, that is not what we're here for primarily.
Right.
Okay, so can you confine your comments or your questions to the issues that we're dealing with here, please?
Okay, that's the last one of this. Okay, please. We have never seen anybody testing the produce in the market if it fit for little children to eat, because if children immune system that start from 7-8, you work, get paid, and then you produce carried poison for your children.
I think I can help you. The remember is right there. You can have a conversation with him after.
So, okay, you know how long I trying to have a meeting with one of them?
Right. Yeah, Mr. Mayor, let's just let the gentleman speak, please.
Oh, yeah. Concerning challenges, files being misplaced, anything along those lines.
Good evening, sorry. Actually, I was skeptical about coming here. It's like what the Prime Minister of Barbados constantly say when she attends United Nations meeting, world meeting. We will come at Glasgow, we will come here and we'll talk and talk and talk and talk. And then what happens after? We had a commission inquiry into Mount Hope, into the medical system. I think Justice Garfu was the person who chaired it. There was a 700-page report that came out, and we just keep talking. I had a situation with my son, and Actually, yesterday was 5 years since he passed away.
Please accept our condolences.
I wasn't going to say anything, but just thinking about him, I say, let me just make a contribution for him. I remember he was born on December 19th, 2007. Went to the hospital. I saw his eyes yellow, his skin was yellow. I guess that it was December 22nd when they discharged him. I guess Christmas time and everybody studying ham, lamb, and jam, and maybe two hoots for the public. And I simply asked the nurse, nurse, I noticed my child's eyes yellow and his skin is yellow. And she just dismissively said, just walk him in the sun. Well, I mean, just carries a certain level of dismissiveness and pettiness and not being important. Christmas Day, observe him. His eyes was very glassy and he just stared at me. I told my wife, I said, here, what? Let's just observe him for another hour or two. After hour two, he just keeps staring. He wasn't even blinking. Took him to Grandy, where he was born. This is Christmas Day, so you could just imagine it was a ghost town. I looked for nearly an hour or two to get a doctor. I finally got a doctor. When the doctor saw him, she said, my God, this child is extremely sick. Into Boxing Day, and literally had to beg one of the lab attendants to run a test on him. I had to see them puncture his bladder while he's up and draw fluid from him. At this time, you have to deal with a screaming wife. The doctor was, you know, it was a kind of soliloquy he was thing, you know, he was saying to himself, what's going on in this place? They didn't do a Coombs test on this child. What's going on here? This is madness. And the guy said he has to go home. He worked Christmas Day. He has a family too. I begged that guy. I begged him. I said, please, just run the test on him. It took about 3 hours before the test came back. And they said they need to rush him down to Mount Hope. It took another 3 hours to get the ambulance. And by the time they reached the Mount Hope, the doctor, they punctured his spine to remove fluid from him because he was about 5-6 days old. So you're looking at meningitis and problems with the brain if the membrane hasn't been fully developed over the brain to protect it from any diseases. The doctor, she lifted him up with one hand on his belly and he just flop over. The head, hand, limbs, everything flop over. She said this child's brain is damaged. I find it was very unprofessional for her to say that way, you know, to tell parents your child brain damage, you know, and the horror that follow after. Went back to Mount Hope. I was just looking in terms of assistance with respect to what different thing the government offer with respect to children with cerebral palsy. By the way, he got cerebral palsy. He was 98% disabled. He couldn't speak, walk, talk, nothing. When we went to the San Grande Hospital again, the doctor in charge of Grande, who actually was my son's pediatrician, and after I sat with him as a pediatrician and I told him all the problems we encountered at Grande, he just sat back and he listened to everything. I went to Grande, told him I need to get his records and whatever on a report. When I got the report, the same doctor who was this pediatrician, he placed in the report that the child born on the 19th, he was discharged on the 20th. I kept him home for 4 days, being a very irresponsible father, and now rushing back to the hospital to say the hospital is responsible. I wasn't even thinking about anything like lawsuit or anything at that moment. So I told him, I said, Doc, I think you have the wrong child. He said, what do you mean by that? I said, because my wife had a cesarean. And I don't know any doctor, any hospital in the world will discharge a woman who has a cesarean after 1 day. You understand? So I realized he was trying to work the figures backwards, work the date backward. If you come on the 25th, be discharged on the 20th, you kept the child home for 5 days, you were irresponsible in dealing with this child, and now you're running to the hospital to claim liability. I said, Doc, this child was discharged on the 22nd of December. He spent 3 days in Grandy Hospital. He grabbed the report from me and ripped it up. He said, getting nothing. I wrote to the Minister of Health then to get a meeting. I told him it was very unprofessional of that doctor. He had a right to state that, here, but sir, this is a conflict of interest. I'm in charge of Grandy Hospital. Yes, I'm your child's pediatrician, but I don't think I should sit here and hear you speak all what happened at Monto, because now it is, you have this information and what went on. I give him a detailed report on it, and you wrote a report. That is how I will feel. You wrote a report based on that information. I thought I was very unprofessional of the doctor. He had a right to say, hey, hear what? I don't want any part of that. I'm in charge of Grandy. And I don't think it's wise for me to sit here and listen to this.
Excuse me. First of all, I'm extremely sorry. We're extremely sorry that you and your family had to go through that. That's a very harrowing, extremely emotionally distressing experience, and you lost your child, so condolences when that is concerned. And we're very happy and appreciated that you're sharing that. Unfortunately, I would like you to, if you could give us a sense of what redress you got, because we're running short on time, and we need to move on.
The Minister of Health at that time, he promised to have an immediate investigation. I didn't even tell them he passed away, and they keep calling and saying, this is after 17 years. And they said that they're still looking into the matter, and the matter will be addressed. And the minister is dealing with this with a level of experience and whatever. And I just laugh in my mind. You know, the eye examination, same thing in 2007. They're still calling and saying, we postpone it for another 2 years because of a backlog. So that might be the next 19 years from since he born, right? And all the different things that we apply for with respect to the institution. One of the things I look at, it is the lack of servant attitude and approach of those in authority. My experience in hospital, they came to his bedside and I said, Doc, what is that you're going to put in his IV? I said, because one of the things they don't tell us as the parents is that what is the control? If I'm to give this child this injection, how the reaction supposed to be? Is it that he's supposed to swell? Is it that thing? And they just come. First of all, they don't address themselves. I am Dr. H, I'm Dr. V, XYZ. Sometimes they don't even tell you good morning, good day, whatever, you know? And I think what happened is the doctors is that it's like a God among men. We are doctors, we all are nobody. A nurse told me when I was there, if all had money, all had been private hospital, all wouldn't be in government hospital. So there's a thinking that is maybe poor people, illiterate people that comes to the hospital, so we could treat them anyhow we want. That is not just in the health sector, that is throughout. That is throughout. We need to have a level of work ethics. We need to hold people accountable. And it's what we are seeing in the society, and that's my perception, is that there are core groups in this country, like they squeeze government hand, their finances and this one and that one, and it's about getting people rich. You may be more concerned about paying the private sector to deliver people to the hospital system. You might more be concerned about paying the billions of dollars a private owner with CDAP. But are you concerned about giving quality healthcare to the people?
Sir, I'd like to thank you. Right, thank you very much for sharing. We are running short on time, so I'd ask everyone to keep your comments as concise as possible, because member Ford can forward the question, and then we have one more section to go, and we are very short on time. So
again, we're dealing with challenges with regards to dealing with a particular health institution, and your files was misplaced, whether it's an actual file or a digital file, whether you needed the information to take to a third party, to a private hospital, take it to your private doctor or whatever, transferring from one institution to the next.
And again, that's what we need you to be as concise as possible because we're running out of time.
Pleasant good evening, everybody. To the panel and all protocols observed. My name is Dave Maraj. And according, I'm just stepping back a little bit, Mr. Chairman. Mr. Naked asked, what do you expect of the Regional Health Authority? I would say free and efficient medical. Just a quick synopsis before I go across to what Mr. Ford is asking. Quick. I suffered a heart attack in 2021 in June, had surgery, open heart surgery in October of the same year. And since then, through the graces of God, everything is moving great so far. One thing to look at, prior to my surgery, the hospital did not have the equipment was malfunctioning. So the surgery could not have been done by the hospital, but it was done through Caribbean Heart Care at Mount Hope facility. So the equipment at these authorities need to be looked after very seriously. My mother is 84 years old. She has to get a pacemaker. And I think I'm going on the 4th year now that I'm waiting for her to get the pacemaker. The last thing they told me, well, I got a call last month saying that, they have to cancel the appointment and this month and put it for 2025, May next.
What is her condition?
Well, she has to get a pacemaker. Whenever her pulse go below 40, she would go into sleep and we'll have to hit her on her face, give her salt water to bring the pressure back up, sort of put a little cold water on her face to bring her back because she will get pale and that kind of thing during these episodes. And that appointment date being skipped year after year is something that you have to look.
Specific topic we didn't.
And when
record
right, so when I went for the first appointment, which could have been 2 years ago, they couldn't find a file, and that we came for an appointment. They called the day before. They say come for the appointment. We went sat below the tent. That was back in the COVID days. We waited until when we did come in for the thing, they say they couldn't find the file and they had to give us another appointment. So that is my contribution.
Thank you very much for sharing. I hope your mother is well and continues to be well.
Thank you.
So keep it very short.
Yes, this submission will definitely be very brief. I just want to add a few recommendations. Seeing that we speaking about digital systems, we're hoping to see in the future more digitization and even the use of artificial intelligence in terms of feeding patient data and so forth. And if it is possible for the committee to consider a digital interface where the patients themselves can access their records as well.
Thank you. Ma'am?
Hi, good night, everyone. I am Janice Scott and I'm from ARIMA. I just wanted to commend the RHAs in terms of what they're doing to digitize medical records, particularly within the ARIMA area, because I would have had an experience where a relative would have had to go for an X-ray, and when they recounted the experience to me, they would have indicated that all radiology services are now being digitized. So whatever is taken from Mount Hope is now being relayed to ARIMA, and there's no need for the actual physical document. And you understand sometimes that things can be lost and it slows down the process exponentially for treatment and so forth. So that in that case, I see that there's a push to digitize records. So I commend.
There's a digital record of your case?
Not my case, our relative's case. Okay. Correct. And further to that is that there's an understanding that there's now prescriptions now, there's connectivity between ARIMA, Eric Williams, ARIMA, Port of Spain, and vice versa. So those records are also digital. And starting tomorrow, those files will now be paperless. So as a young person, it's always good to see, because we don't really like to see paper and care about the environment. And we also want to ensure that while we're focusing on that, the records are there
and it cannot be lost for the proper and efficient services of the people. So making sure that those records are now digitalized and that can improve the efficiency and how quickly persons can be serviced within the public healthcare system. I really like to commend the efforts for doing so.
Thank you so much. It's interesting. When you hear, and this is not directed to you, thank you so much. We're gonna have to wrap up. We have one more section. The frustration that has been expressed not only in this forum, but in the three previous fora, about records being lost and patients' wait times and efficiency and interconnectivity between RHs is not what we have heard. So while it may be happening and a process is ongoing, it's always interesting for me to hear when it's starting tomorrow. That's a little convenient for me. You know, when people start to experience it en masse and people's experiences start to change, then I will say it's happening. Until that time, I can only take the word. And this is a subset, a sample of the wider Riemann and Barron's district. And while we've had pretty good, some good experiences, the larger proportion of the experiences have been abysmal. And we cannot discuss, everyone is here. So while I commend the Ministry of Health for the thrust to digitization and digitalization, I think it needs to happen a lot faster. And it needs to directly impact more people to make their experiences more seamless, because these are people's lives you're talking about and people's health experiences. Member Manu.
Thank you very much, Chairman. And the panel. Good evening again, everyone. Thanks for your honest responses thus far. I would touch on prevention and public awareness initiatives. I would group my questions in three because of our time constraint. So I would like to ask to the general public here, in your opinion, do you think enough is being done at the state level to educate the public on preventative measures that we can take to reduce non-communicable diseases in Trinidad and Tobago? I'll also ask if you believe that there's adequate information available to the public on treatment of NCDs, diseases such as cancer, diabetes. My other question to the general public, what do you suggest that the government can do to improve its strategies to encourage men to seek early screening and treatment for non-communicable NCDs? And this question is for the men. I know we have a lot of men here, and I'm asking that you do respond. We look forward to your response.
And we're going to limit the comments to this particular topic alone. I work in the media, so I know about some of the ministry's initiatives, including TT Moves. The ministry has several health fairs and caravans throughout the country. I've heard about them because I work in the media. But have you heard about them and have you participated in them? That's the question. Ma'am?
Good evening, everyone. Good evening to the head table. Sorry for my retirement. I come from exercising.
No, you're looking good. You apologize.
I am Donna Gilbert Bonds. I am a member of the North Central Wellness Group that takes place in Etihad Ground every Tuesday, Wednesday, and Thursday. And I want to say thanks. Thanks for that. We have a doctor on site. We have a nurses on site that take our blood pressure. The doctor give us free consultation, and it's extremely a well group of ladies and gentlemen that come together every Tuesday, Wednesday, and Thursday for aerobics, Tai Chi, kickboxing, and I'm inviting others to come out at Etihad Ground. It is free. You're getting your blood pressure check, diabetic check, you're getting free consultation. And thanks to the government.
How often is it?
It's 3 days a week, Tuesday, Wednesday, Thursday, 5 to 6. Okay?
And gentlemen, you're getting the exercise next to this beautiful woman. So go on exercise. Thank you so much. Anyone else has an experience with the and we're asking to keep it concise, with the promotion of healthcare initiatives by the Ministry of Health, and if you have experienced it, the health caravans, the exercise initiatives, etc.
Mostly TTT, I get my information from, and some the advertisements, sometimes the morning show, because I'm home now, I'm retired. And then WhatsApp groups we share, but I don't think it's really out there for the general public that there's something on. It's somebody who sent this on their status that I picked this up on in particular. One of the things in terms of people's education, where I've had to go in the hospital with other people, or the ambulance comes home, they ask you a lot of questions. I think, yes, they may have a card, but that card means you have to hook into the system. We need, like how we have in vaccination, a card that we could have recap that we could give them in case you can't talk, you might be having a heart attack or something, even for our children. In terms of education, I'd spoken about it before, that in schools, sharing about just regular healthcare and helping for the males to be interested. So that's
more health promotion generally. Thank you so much. Sir.
Good afternoon again. My recommendation for us men, which I'm not seeing, I don't see it much when it comes to prostate testing. We don't have a caravan for all men. Prostate testing costs a little more. Some men don't like the finger. When it comes to prostate testing, I do it regular, once a year. We are men, boys to men. And I want to believe that for us men to really get that part of it, that a caravan would be something that I can see that can go through a neighborhood, go through a community, and have our men come out there. Maybe their wives bring them out or their daughters bring them out so they can have this testing done. Because that's where it starts. It starts with the testing. It starts with us coming out there. And if we have to fight to get to it, we're not going to go.
Yeah, understood.
Simple.
Thank you, sir.
Right? And in closing, I really want to say that within the health sector, we are Mr. Knocking out of asking questions. But for me, I would like to see that the public health sector stay the public health sector, and the doctors who work in these health sectors work in the health sectors alone and not in the health sector and in the private sector at the same time.
Thank you. Final comment?
Final comment. Greetings, Honorable Penelope Beckles, staff. My name is Dr. Robert Moultrie, and I want to tell you, everybody, thank you so very much for this. I have been in this system and experienced and saw a lot of what you experienced and saw. And I saw the only way to make the changes was for your voices to be raised. So I'm so happy to hear two things. One, for your voices of courage to be raised, and two, for people of sincerity to listen to what you have to say. You have, if I can ask, you have a part of the presentation of this section was to ask for some prevention. Am I able to share a couple of thoughts of prevention of communicable diseases?
Very, very concise.
Okay, I'll be very quick and very concise. One, prevention is psychosocial issues very much have a big effect upon the mind, and that affects the body's health. So while we deal with the various communicable diseases as such in its individuality, we must also take into a high account the issues of what's going on in our society, in our relationship. That we're passing down the generations, causing crime and distress in the communities. They have a big effect upon what happens upon the family members, the elders, the children, even the unborn in the 9 months. Other thing I would like to say in that regard, in dealing with all these issues, is to do some work to bring all of these things together so that there's systems that help individuals are working with each other and are supporting. One person gets many levels of different kinds of support as a result of this, not just an individual thing. I want to say, you know, to move things forward, we have to have compassion for the doctors and see what's going on with the system. December 25th. I've been into this nonsense and that's just too long. So what's happening? But one thing that I see that's a major problem is we have a lack of empathy, intelligence all around. There's a lot of people that lack empathy. And we have people in our systems helping other people that just don't care. And we need to address them. It's not just the people who are elected to government. We have to look at what's going on who's inside our system. I have much more to say, but I would like to put some things forward. Thank you very much.
Thank you so much. We'd like to thank you all for your comments. Those of you who have further comments, you're asked to provide feedback. You would have been given some feedback forms in the Parliament bag. Some of you received on entry. And you can also send emails of further comments and more details to the Parliament email, parl101@ttparliament.org. That's parl101@ttparliament.org. I'd like to thank you all for being here and for your honesty and your candor and sharing your experiences. It's very important for us in terms of gathering the information we need to complete our report and make the recommendations to the relevant authorities. I'd like to thank the committee members for coming out here and for their continued support. We'd also like to thank the stakeholders who participated today, and Dr. Jamila Augustine, representatives of NGOs, professional organizations, and of course the management team at the Aruma Community Center. Give them a round of applause, please. We'd like to thank the members of the Eastern Regional Health Authority. We'd like to thank the members of NALIS for helping us with today's presentation, the National Information and Communication Technology Company, IGov, and the Trinidad Tobago Postal Corporation. Special thanks to the Office of the Parliament and the Parliament staff for their continued procedural and logistical support, and of course the viewing and listening audience who participated. On behalf of the committee, I'd like to thank you all and wish you a good night and safe passage home. Our town hall meeting is now adjourned. Thank you for being here and be safe.